We're talking today about solving some of the current problems we're seeing in healthcare. If you are like most of us in healthcare, the current situation is causing pressures on you from every angle. A lot of it is good, what's happening. We have healthcare reform causing us to look at the way we're ultimately going to get paid. We have the American Recovery and Reinvestment Act giving us stimulus dollars for installing electronic health records and using them in a meaningful way. But often all of these different pressures coming in pull us in different directions. As hospitals are getting ready, full speed ahead, to install an electronic health record or to upgrade an electronic health record to meet meaningful use requirements in order to get those stimulus dollars, they're often doing so, but not necessarily setting themselves up for what might really work for them 3 to 5 years down the road when we are full speed ahead into reform. One of the problems we see commonly is hospitals or healthcare systems will choose a single vendor solution to get them to meaningful use, which that's fine, but often that single vendor solution then is not going to necessarily take them where they need to get to in the future or to bridge the gap. When we encounter hospitals that have many disparate systems that they would like to work with and pull together in order to bridge some of those gaps and allow them to make smart, well-informed decisions going forward, we often recommend a patient information exchange. Hospitals often consider patient information exchange when they have a variety of problems. One is the problem of needing to sign on to multiple systems on the part of the clinicians in order to get their job done. Whenever I walk into a hospital and I hear physicians moaning about, remembering 3 or more passwords, that's a great time to start a conversation about a patient information exchange. Another is when we have hospitals in transition, as so many are now, not quite sure exactly what their long-term electronic health record solution is going to be, not quite sure exactly where they're headed in the future with the need to share information as they begin to participate in accountable care organizations and other payment structures. As hospitals are in that transition and deciding, a patient information exchange really can buy them some time and keep their physicians happy in the work they're doing in the meantime. Another problem that we commonly hear in hospitals after they have installed an electronic record and perhaps a complex one, they often have a lot of trouble reporting out of those systems and figuring out how to keep a skilled staff ready to be able to write those reports that they need on an ad hoc basis, answering off-the-cuff questions. It is much easier to run reports out of a simple patient information exchange than it is in some cases out of an electronic health record. So when I hear of hospitals struggling with getting information out of their systems, I often recommend that they consider a patient information exchange. One other thing to keep in mind when you're considering how to make information easy for your physicians to access is, how are we going to make it easy for physicians to pull all the data together that they need to do their job, for example, morning rounds. So when a physician comes in to do rounds and has to access data from disparate systems, often what we'll see happening is we'll see her pull up data from an electronic health record and maybe jot some of that down on a little 3x5 card and then go into maybe the PACS system or a different lab system and jot some of that information down and come up with a manual rounding sheet. We see this happen all sorts of different ways in different hospitals. Sometimes it's an electronic process, but rarely is there one place where that physician can go where all of that data is already collated and brought together, where it can easily be either viewed on the screen or printed out and brought around. Another problem commonly encountered by healthcare systems is that of security. Physicians and the staff from physician offices often need to access the electronic record in the hospital from afar. There are ways to do this. that seems simple and easy for them, but it's often difficult to really understand who's accessing what data and where you may or may not have a security risk. We have examples of staff in offices accessing hospital data, being able to move all around, seeing patients that really they have no reason to need to see. That causes a problem for the hospital and a security risk. When there's a patient information exchange in place, we can put much tighter controls on who has access to what data through one system without having to worry again about all of those other systems that are underneath that people may be accessing. Hospitals are often faced with how they're going to solve the problem of giving their clinicians all the information they need to make decisions. One option that hospitals consider is putting in one large single vendor electronic health record solution with the thoughts that that will solve all of their problems. And in some cases, it gets them pretty close, but it is a rare healthcare system that doesn't have bits of data hanging out there from previous systems or that needs to come in from other campuses that is all nice and neat and easy to put right into one electronic health record system. What a patient information exchange does is it allows for an easy way to help that information flow into one place. The other reason to pull data into one system like a patient information exchange is for the purposes of business intelligence and ultimately analytics. So right now, you may have a question that you want answered. You're going to run a report out of your electronic health record on how many patients with a certain disease came in and had, say, X treatment. When you've had data in different systems over the previous periods of time, it's difficult to be able to run that just out of one system and get a true answer. But when all of your data flows into a patient information exchange and you can query out of that information exchange, you get a much more complete picture. It's much easier to put a data analytics layer on top of a patient information exchange where all of the data is, rather than having to work with separate systems. The desired result is having all of the information that a clinician needs to make a decision about a patient and move forward, have all of that information in front of that physician on one screen. And it's really difficult to do that when you're looking at either a single vendor solution or moving ahead just to meet meaningful use dollars.